Diabetes causes a multitude of serious problems throughout the body if not controlled. One of the problems is nerve damage, which causes a loss of feeling in the feet. Dr. Jackson Crough, a foot and ankle surgeon at Desert Regional Medical Center, explains why people with diabetes develop wounds on their feet.
Diabetics tend to get wounds because they end up with a problem called peripheral neuropathy. Neuropathy is just a fancy word meaning a dysfunction of the nerves, very common in diabetics. So without the ability to sense pressure on a diabetic's foot, it's very common for even a small blister to turn into a wound. Any sort of trauma, these tend to be exacerbated by problems with blood flow with diabetics as well. So in dealing with issues of blood flow and lack of sensation, these wounds can tend to be very problematic in diabetics. Also, diabetics are very poor at fighting infection, so that normal infection that you may get with a small little cut that you think is nothing, in a diabetic can turn into a huge problem very quickly without the blood flow to heal the wound, without the ability to fight the infection very well.
With diabetes on the rise, podiatrists will see more of these wounds.
Diabetes is a huge problem in our American population. Obviously, about 15% of this population has diabetes. A huge percentage of those people will go on to develop sores in their feet. So there's always going to be need for me and for other doctors here at the hospital to treat that.
There are many options for treating diabetic wounds.
The best way to treat these wounds in diabetics is to try to take the pressure off of them. If we can relieve the pressure in that spot, whether it's from rubbing, whether it's from a sore on the very bottom of the foot, on a bony prominence, just relieving the pressure is a great first step in getting that wound to heal, in kind of removing the continued trauma to that area. These tend to require very effective wound care as well in order to get them cleaned up. It's a job of it's my responsibility, as well as kind of a team of different doctors in working to kind of all treat the diabetes as well as treating the causes of the wounds. There are lots of different options to treat these wounds as well. They can range from just making sure they're clean, making sure they have the right dressing on them. There are more advanced modalities like hyperbaric oxygen, which Desert Regional has here, which can deliver oxygen much more effectively to the source of the wound and heal it much more quickly. With the diabetics, even with appropriate wound care, with appropriate offloading, with all the work that we do at the hospital, just the ability of the body's ability to heal is much more delayed with diabetics.
By the efforts of a medical team and the patient, wound care is now very successful.
Medical science is very successful in treating these wounds, especially more recently. We've developed a lot more advanced modalities as far as treating these wounds. Before we didn't really understand the wounds. Now we have a much more precise understanding as far as how to treat them, what dressings to use, what causes these wounds. There's also a lot of surgical steps required sometimes to treat these wounds, to take the pressure off these sores, and that's where a surgeon would come in. My job would be to remove any of the bony prominences that could be causing these wounds. There's also a disease process called Charcot neuroarthropathy, which are a lot of fancy words, but just describing a breakdown of the bones in diabetics, which is a common side effect in diabetics. It's very serious. This requires a surgeon to go in and basically reshape the architecture of the foot in order to prevent any large ulcers from happening.
A team approach has been proven to effectively treat diabetic wounds.
The wound care center is actually extremely important in treating wounds as well. We have a team of specialists there that work solely in wounds, from the nurses to the physicians. They're treated much more effectively and much more timely and appropriately than if they were just to go see a primary care physician. So I certainly recommend people with wounds that have been dealing with wounds long-term or just acutely to come see a wound specialist. It's extremely important.